Hey, Mr. Chairman, had I not read my schedule, I would have thought maybe this hearing would have been titled Our Broken Tax System, which, by the way, anytime we have the chairman of the Finance Committee, anytime you two want to sit down and work to simplify and rationalize our horribly complex and broken tax system, I'm all in. But this is a hearing on Medicare, and unfortunately, I think the chairman and so many Democrats are pretty much one-trick ponies. Whether it's Social Security, whether it's Medicare, the only solution is increasing taxes, which, again, I don't think we ever generate the revenue by increasing taxes because it harms economic growth. From my standpoint, if you're looking at how to fix Medicare, you've got to look at the root cause of the problem. And I would argue the root cause of the problem is the cost of health care. Why is it so grossly expensive and out of whack with other nations? There are many reasons, but I would argue we have largely removed the benefit of free market competition out of health care across the board. And again, I come from the private sector. I didn't like competition. I would love to have been a monopolist because I had to compete. My prices were a lot lower. My quality was a lot higher, as well as my level of customer service was a lot higher. That's what a functioning free market system does. Unfortunately, in health care, only about 10 cents of every dollar is paid by the patient, and 90 cents is paid by somebody else. And so we have no idea what anything costs. There's really no consumerism involved. There's not consumers making wise choices and calculating what something costs versus what the benefit is. So, Mr. Capretta, you did, in your testimony, mention three forms of competition. You said choice, you talked about premium competition, you talked about provider competition. I mean, would you basically agree with my assessment there that the root cause of this is we need to interject the benefits of a competitive marketplace into healthcare? And that's what we ought to be talking about here.
The answer is yes, but it's complicated, as you know, which is why it hasn't been done. In healthcare, I think it's important to understand there has to be some structure. There are some market failures in healthcare. I wrote a book recently. I'll make a plug for it, U.S. Health Policy and Market Reforms and Introduction. Kind of covers the, as an introductory matter, sort of different things that need to be done to bring more discipline from the marketplace into the health system. It can't be done, though, just by deregulation on its own. It has to be structured so that the person who's making a choice can see very clearly a price difference based on the same insurance plan or the same medical service. So that means in the insurance context, standardization of the benefits so that the premium difference is very clear.
Let me quickly interject. I think also you need to separate healthcare costs in terms of the catastrophic costs that need insurance and the non-catastrophic that people could pay for out of their pocket. I think, if we could separate that in some way, shape, or form as opposed to paying for everything. I have limited time. I also want to talk about figure one. You talked about the fiscal challenge. I would call it a fiscal crisis. It's a slow-moving train running right at us, and Washington, D.C. is not addressing it. We're, as you said, about a $2 trillion deficit this year. We're spending $1.9 trillion more this year than we did just 4 years ago. And your figure one is pretty stark, showing that about half of Medicare costs are going to be provided by the General Revenue Fund. We're going to have the same problem with Social Security when the trust fund runs out. If we're going to plus up those benefits, we're going to need revenue out of the general fund. And the question I have is, will we have the financial wherewithal to plus up those benefits, to meet the requirements of what Medicare is going to need in terms of financing? And that starts to speak to prioritization of spending. We've used this committee for climate change and the budget. Talking about, by the way, in testimony, over $5 trillion has been spent globally combating climate change. I would argue it obviously hasn't made a dent because we still have climate change alarmists. $5 trillion. We're in the Inflation Reduction Act, another $1.2 trillion, according to Goldman Sachs study, is what is going to be spent because of that piece of legislation. We need to start prioritizing what limited resources we have to the priorities of government. And again, I would say Social Security and Medicare, those promises we made to seniors would be top priorities, and maybe these green energy boondoggles that are not going to fix climate change would probably be a lower priority for spending. Would you like to comment on that?
No, I don't think so. I'm not an expert in the.
Okay, set aside climate change, just in terms of we need to get our arms around these massive deficits, this massive debt, or we're not going to have the financial wherewithal. We'll have a debt crisis, and then this all comes crashing down, correct?
I do think we are headed towards some major dislocation if we don't get fiscal discipline into our budget process. So I would very much recommend on a bipartisan basis that both sides get together and start working through some of the challenges of getting the debt down, deficits down, so we don't pile up as much as we're projected to in the coming decade and certainly over the coming 30 years. It's really a very big problem, and it's going to require both taxes and spending.
But also
restraint.
prioritization of spending. Okay, thank you, Mr. Capretta. Thank you, Mr. Chairman.
Thank you, Senator Johnson. Now we